Thank you and welcome to the House Minister. A health topic for you as you peruse different topics here today. So following out from the RT Investigates programme last night, and I hope you've seen it, and if not, I'd certainly recommend you take a look at it. I want to ask the Minister, or you on behalf of the Minister, when will the recommendations of the O'Shea report be enacted, and what is the timeline the Government have put in place for examining those recommendations and enacting them? Anyone who saw the programme last night will surely agree that we are in urgent need of legislative action. The documentary shone a light on the harsh reality of the exclusionary and restrictive provisions of the law. The Marie O'Shea report, this review was published in April 2023, yet this progress is awaited on for many of the recommendations. The call for immediate action is also reflected on the conclusions of the Oireachtas Joint Committee on Health, which you and I both have sat on, whose December 2023 report supports the review's recommendations, describing them as necessary measures to ensure the 2018 Act meet the needs of women and pregnant people, and our Health Committee report called on the Government to advance the implementation of the report without delay. I will acknowledge efforts to improve operational aspects of abortion services in the past year, including that 17 of the 19 maternity hospitals are now providing care. But we still have significant barriers to equitable and accessible abortion services. These barriers include ongoing criminalisation, the mandatory and patriarchal 3-day wait, inadequate data collection, lack of safe access zones, uneven geographical coverage, and the narrow, rigid legal criteria for abortion access after 12 weeks, including the 28-day clause for fatal fetal anomalies. And these obstacles have resulted in women and pregnant people being denied timely reproductive health care and in many cases being forced to travel abroad. I don't believe that that's what we voted for. I remember spending quite some time on that referendum campaign, and we were putting women out and putting their stories out, really hard, difficult stories of fatal fetal abnormalities discovered after 12 weeks, having to travel, having to live with the shame and secrecy. And those are the things that we went door to door talking to people about. So I don't believe what we saw last night on that documentary is reflective of what people voted for. On the documentary last night, we heard about a couple whose baby Rose had to be brought back on ice, and then they had to put her baby in the boot of the car and cover their baby's body with coats so that they could get their baby through customs. I don't believe that that's what people voted for. Another couple talked about having to leave their son behind because they wanted to get a post-mortem, and coming back 5 weeks later and finding their son's body decomposed. I do not believe that is what we voted for in May 2018. I don't believe that that is what the people wanted to see continuing to happen to women. It's estimated that about 860 women have travelled from Ireland to the UK to access abortion services since the 8th Amendment was repealed. 85 suspected in the first part of 2022. I personally know a number of women who still have to travel, and I'm stunned that I know people who had to travel. I don't believe that's what we voted for. So we need necessary legislative and operational steps. These include full decriminalisation of abortion in line with the WHO guidelines to remove the chilling effect on healthcare providers. We need to remove the mandatory 3-day wait period. We need to review the 12-week gestation limit to ensure women and pregnant people are not timing out of care and forced to travel abroad. The Citizens' Assembly recommended a 22-week cut-off limit for fatal fetal abnormalities. So this is not outside the realms of what was discussed during the process that we got to ahead of 2018. We need to recruit a HSE primary care lead for termination of pregnancy to address gaps in training, guidance and data collection. We need to expedite safe access zones legislation. I know we have that in here later on today. And we need to regulate rogue crisis pregnancy agencies who are quite frankly acting with impunity.
Thank you, Senator.
And thank you indeed for your contributions in the Health Committee, and I enjoyed being on the Health Committee with you. Minister Donnelly has asked me to deal with this Commencement matter. I would like to begin by thanking the Senator for giving me this opportunity to address the House in relation to the review of the operation of the Health Regulation of Termination of Pregnancy Act 2018. The Health Regulation of Termination of Pregnancy Bill 2018 was signed into law on the 20th of December 2018. Expanded termination of pregnancy services have been available since the 1st of January 2019. The Act allows termination to be carried out in cases where there is a risk to the life or of a serious harm to the health of the pregnant woman, where there is a condition present which is likely to lead to the death of the fetus, either before or within 28 days of birth, and without restriction up to 12 weeks of pregnancy. This is in line with the recommendations of the Joint Oireachtas Committee on the 8th Amendment of the Constitution, which published its report and recommendations in December 2017. Prior to the May 2018 referendum on the 8th Amendment, the general scheme of the bill to regulate termination of pregnancy was published. The final legislation enacted is consistent with the published proposals. In line with statutory and government commitments, the Minister for Health commenced the review of the operation of the Health Regulation of Termination of Pregnancy Act 2018 at the end of 2021. The final report of the review was submitted to the Minister at the end of February 2023. The report makes a range of recommendations, most of which are operational in nature, with some proposing legislative change. The report was considered by the Cabinet in April 25, 2023. Following the meeting, the Government agreed that the HSE would establish an implementation group to progress the operational recommendations, while the proposals recommending legislative changes were referred to the Joint Committee on Health for consideration. In December 2023, the Joint Committee on Health issued their report on the legislative recommendations. The Minister for Health has now asked for further consideration of this issue at the Cabinet Committee on Health. The HSE established an implementation group and identified the recommendations that relate to the operation of the service. An action plan for the implementation of these recommendations has been developed. 10 work streams have been identified. The implementation group is chaired by the Director of the HSE's National Women and Infants Health Programme. The National Implementation Group includes multidisciplinary representation comprising healthcare professionals across the TOP pathway and service users with lived experience of TOP services. The first meeting of the Implementation Group took place in October 2023, followed by 5 subgroup meetings held in December 2023. Meetings of this group are ongoing. An overriding message of the review is centred on the need to increase access. Substantial strides have been made in this regard. For instance, 6 additional hospitals came on board in 2023, an increase of 55%. Termination services is available. Termination services in early pregnancy up to 12 weeks are now provided in 17 of the 19 maternity hospitals, with the remaining 2 expected to come on board in 2024. There has also been a small but sustained increase in community providers, approximately an additional 20 in the last 12 months alone. Furthermore, the revised model of care introduced in response to the COVID pandemic has now been approved as the enduring model of care. With this blended approach, it is possible for one of the 2 consultations required for termination in early pregnancy to take place remotely. This will alleviate the time and expense involved in travelling to the doctor's surgery twice, and would be of particular benefit to those seeking to access services in remote areas or in areas that are poorly served at present. Safe access legislation is at an advanced stage. It's in progress through the House of the Oireachtas. Indeed, the next committee stage session takes place in this House this evening. It is the Government's priority to have this legislation enacted as soon as possible. It is hoped that the cumulative effect of these measures will substantially reduce the barriers and increase access to services for those who need it.
Thank you, Minister. Senator.
Thanks, Minister. A lot of the changes you've outlined, they're not the required legislative change that we need to see, like that is what we want. The recommendations in the review have a robust evidence base. They're rooted in qualitative research of the lived experience of women and pregnant people who have accessed abortion services since the commencement of the Act. And this is a government reviewed or government commissioned review, so we do need to immediately progress legislative amendments and service developments that accurately reflect the findings of the review and the research underpinning its recommendations and international best practice as set out by the WHO. The reason the review clause is put in is because we recognise that healthcare cannot remain frozen in time. So I know that there's plans, but the government cannot delay the necessary legislative and operational changes any further, and we do need political leadership to ensure that Ireland's reproductive healthcare system is equitable and is responding to the emerging evidence and clinical best practice so it can meet the needs of women and pregnant people. We voted for care, compassion and dignity, and it strikes me that until we enact the O'Shea report recommendations, we're simply not going to get what we voted for.
Senator, it is worth noting that the Health Regulation of Termination of Pregnancy Act 2018 is of relatively recent provenance, having been in operation for just over 5 years. For much of that time, it has been operated under the challenges of COVID-19 pandemic. Nonetheless, it is recognised that the service has embedded well into the health sector. As outlined, we now have 17 of the 19 maternity units providing that service, and the other 2 will come on board in 2024. However, it is acknowledged that some challenges remain. The Department of Health will continue to work with the HSE and other relevant stakeholders in addressing these and ensuring the service is available to those who need it. Thank you.
Thank you, Minister.